Good morning, everyone. Today we are going to learn about the different methods to prompt through behaviors and skills. This training will prep you on the different types of prompts and the different ways to go about prompting through a skill. Prompts are an effective tool for educators, therapists, and others in the field such as applied behavior analysis to help an individual learn a new skill. These prompts are extremely helpful for clients with disabilities who may learn differently or need additional assistance. The purpose of a prompt is to help an individual learn a new skill. However, the end goal is for the individual to be independent in the target skill. Therefore, we want to fade these prompts as soon as possible. There are many different prompts when teaching an individual a skill. There is the use of a gestural prompt in which the therapist would gesture a point. For example, let's say you tell a child to sit in a chair. The child is unresponsive. You might point to the chair as a gestural prompt, then the child sits in the chair. Next, we have a verbal prompt. This includes clues, hints, and questions. A great example of this is if you ask a child, what animal says moo? The child errs or is unresponsive. You might give clues such as it also has spots. It also gives us milk. This would prompt the child into saying a cow. We also have visual prompts. A visual prompt is a picture or words that can prompt the individual to complete the task. We see this often in the natural environments such as exit signs, push and pull signs, street crossing signs that show us when and when not to walk. Next is a model prompt. This can be in the form of a full model in which the therapist would model the full skill for the individual to imitate, or a partial model in which the therapist might complete only a portion of the skill. Next, we have a proximity prompt in which you would position the item, your body, or another object towards the goal. For example, if a client is building a Lego design and is erring on a step, you might position the Lego closer to the individual. Finally, we have partial and full physical prompts. A partial physical is when you would give assistance to the individual physically, such as a light touch on the elbow, and guide the individual towards the appropriate behavior. A full physical prompt would be hand-over-hand prompting in which the client is unable to err. There are a few different ways to prompt through a skill. Least to most prompting is exactly how it sounds. You begin with the least intrusive prompt level and then work your way through the higher prompting levels. Most to least prompting is the opposite. You begin with the most intrusive prompt level and fade your prompts from there. Both of these methods have an added procedure of a time delay in which you would wait a predetermined amount of time to implement prompting. For example, you would place an instruction and then give a client 5 seconds to complete the skill independently. If they do not attempt within this 5 seconds or they err, you would begin prompting. When working with children on the autism spectrum, there are many instances in which they will require prompting. Autism brings forth many communication and language deficits, challenging behavior, difficulty with fine motor and living skills, deficits in social skills, and inappropriate play skills. Some of the instances you can plan for, such as a task analysis, where you would break up a skill into smaller portions for them to learn. However, there are instances in which you might be unprepared for the specific behavior and need to know how to best prompt through the situation and the different types of prompts we learned previously. When going to prompt through a least to most prompting procedure, you want to begin with the least intrusive prompt level. This might mean giving the individual a chance to do the skill independently. Then if they err or are unresponsive, you will begin with a prompt that is not very intrusive. For example, if you tell a child to stand up, you might wait a few seconds for the child to comply. If they are still sitting down on the floor after 5 seconds, you might gesture in the direction they are attempting to walk. If they are unresponsive again, you might put your hand on their shoulders to prompt them up as a partial physical prompt. If they still do not comply, you could put both of your hands under their armpits and stand them up. This would be a full physical prompt. When looking at how to sequence most to least prompting, we are going to do the opposite of the least to most prompt sequence. When you jump into prompt, you will jump in with the most intrusive prompt you're going to use and then fade your prompts from there. For example, you are teaching an individual to brush their teeth. This task is new for them and therefore they are likely to err. You decide to prevent the client from erring. You will full physically prompt the skill and then fade your prompts to less intrusive prompting, such as full physically prompting them by putting your hand over their hand, then moving your hand to their wrist to prompt, then gesturing to the correct toothbrush placement, then removing your prompt altogether. The diagram above is a study which compared prompting procedures such as least to most and most to least, and both with a time delay on the effects of individuals with autism building a Lego design. As you can see, the researchers used least to most prompting by allowing the learner a chance to complete the skill independently. When they erred, they would go in with a light touch. If they needed more assistance, they kept increasing the amount of prompt levels. On the other side, They also implemented most to least prompting by fading their prompts as needed. To decide how many prompts should be in your hierarchy when implementing a target or a new skill, you want to look at a few things. First, what is the task? Harder tasks require more prompts on the hierarchy, and easier tasks require fewer levels on the hierarchy. Another thing you should look at when creating a prompt hierarchy for a skill is the individual client. Does the client have a hard time attending to a task? If so, having many steps in the least to most prompt or most to least prompting may lose the attention of the client before the right level of assistance is given by the therapist. Additionally, if the client has a history of complying with the task, you might want to implement fewer levels on the hierarchy. Each client has a different skill repertoire. If you know a client only needs a gestural prompt, you do not need to jump in with a more invasive prompt level. Remember, the end goal is to have the client gain independence with the skill, and we want to fade our prompts as soon as possible. A good rule of thumb is to rely on most to least prompting if the skill is brand new, so they do not error. Say you are teaching teeth brushing to an individual with special needs who has no learning history of brushing his or her teeth. We would want a more intrusive prompt so the individual does not err consistently while she is being taught. Then fade these prompts to an independent skill. The therapist or BCBA should always be monitoring the progress to ensure errors are not impeding the acquisition of the skills. I hope this is helpful for learning about least to most prompting, most to least prompting, and the different levels of prompting.